Top 12 Dangerous Diabetes Nighttime Signs You Should Know. Did you know that diabetes symptoms don't just happen during the day? In fact, some of the most dangerous warning signs show up at night, while you're asleep. If you've been waking up thirsty, feeling restless, or experiencing unusual nighttime symptoms, your body might be trying to tell you something. Ignoring these signs can lead to serious complications, including nerve damage, heart problems, and even dangerously high or low blood sugar levels. The scariest part: many people don't even realize what's happening until it's too late. Stick around because number 1 is a warning sign that often goes unnoticed but could mean your blood sugar is dangerously out of control. Diabetes doesn't take a break when you go to sleep. In fact, some of the most dangerous warning signs happen at night when you're least aware of them. If your blood sugar is too high or too low, it can disrupt your sleep, trigger uncomfortable symptoms, and even signal serious health risks. Ignoring these nighttime signs can lead to complications like nerve damage, heart issues, and worsening blood sugar control. But the good news? Recognizing them early can help you take control of your health before things get worse. In this video, we'll reveal 12 nighttime signs of diabetes that you should never ignore. If you experience any of these, it might be time to check your blood sugar and make some changes. Number 12. Frequent nighttime urination. Do you find yourself waking up multiple times during the night just to use the bathroom? This could be a major warning sign of high blood sugar levels. When there's too much glucose in your bloodstream, your kidneys have to work overtime to filter it out. Since the body can't store excess sugar efficiently, it gets flushed out through urine, leading to frequent urination even in the middle of the night. This condition, known as nocturia, is one of the most common but overlooked symptoms of diabetes. Many people assume that waking up to urinate is just a normal part of aging or drinking too much water before bed. However, if it's happening regularly, especially if you feel excessively thirsty afterward, it could mean that your blood sugar levels are too high. Frequent urination at night doesn't just disrupt your sleep, it can lead to dehydration as well. When your body loses too much fluid, you may wake up feeling parched, with a dry mouth or throat. This dehydration can also cause headaches, dizziness, and daytime fatigue, making it harder to concentrate and function properly. Over time, chronic dehydration can impact kidney function and increase the risk of other diabetes-related complications. Another hidden danger of nighttime urination is poor sleep quality. Constantly waking up throughout the night prevents you from reaching deep, restorative sleep stages. This lack of quality sleep can worsen insulin resistance, making blood sugar levels harder to control. Studies have shown that poor sleep is linked to an increased risk of type 2 diabetes, weight gain, and heart disease. So, what can you do about it? If you're experiencing frequent nighttime urination, it's crucial to check your blood sugar levels. Reducing sugar intake, staying hydrated throughout the day, but limiting fluids right before bed, and managing stress can all help stabilize blood sugar and improve sleep. However, if this symptom persists, consult a doctor to rule out underlying issues and prevent long-term complications. Number 11. Excessive thirst at night. Do you often wake up in the middle of the night with an unquenchable thirst? If you find yourself constantly reaching for a glass of water, your body might be trying to tell you something. Excessive thirst at night, also known as nocturnal polydipsia, is a common sign of high blood sugar levels. When blood sugar levels rise too high, the body pulls water from tissues in an attempt to dilute the excess glucose in the bloodstream. This process leaves you feeling dehydrated, causing dry mouth, a scratchy throat, and an overwhelming urge to drink water. You might think it's just because of dry air or something you ate, but if it happens frequently, it could be a warning sign of poorly controlled diabetes. The problem is that drinking more water leads to more frequent urination, which can create a vicious cycle of waking up thirsty, drinking water, and needing to use the bathroom multiple times a night. This repeated disruption can lead to poor sleep quality, leaving you feeling exhausted the next day. Lack of proper rest can further impact blood sugar control, making it even harder to manage diabetes. Excessive nighttime thirst can also indicate other serious complications, such as diabetic ketoacidosis, DK, a life-threatening condition that occurs when the body starts breaking down fat for energy due to a lack of insulin. DKA can cause extreme dehydration, confusion, nausea, and even coma if left untreated. So, what can you do? If you notice persistent thirst at night, start by monitoring your blood sugar levels before bed and in the morning. Stay hydrated throughout the day, but limit fluid intake right before sleep. Avoid sugary drinks or caffeine in the evening, as they can worsen dehydration. If nighttime thirst continues despite lifestyle adjustments, speak with your doctor to ensure your diabetes management plan is on track and rule out any underlying health concerns. Number 10. Sweating while sleeping. Do you ever wake up drenched in sweat, even when your room is cool? Night sweats can be a hidden warning sign of blood sugar imbalances, especially hypoglycemia, low blood sugar. When blood sugar drops too low during sleep, your body releases stress hormones like adrenaline to compensate. This triggers symptoms like excessive sweating, rapid heartbeat, shakiness, and even nightmares. Some people may not fully wake up when this happens, but they might notice damp sheets, soaked clothes, or an overall feeling of discomfort. Low blood sugar at night, also known as nocturnal hypoglycemia, can happen for several reasons. Skipping meals, taking too much insulin or diabetes medication, or exercising late in the evening can all contribute. If left unchecked, severe hypoglycemia can lead to confusion, dizziness, or even unconsciousness. On the other hand, high blood sugar, hyperglycemia, can also cause night sweats. When glucose levels spike, the body struggles to regulate temperature properly, leading to excessive sweating. This can be especially concerning if you also experience frequent urination, dry mouth, or blurred vision. If you frequently experience night sweats, it's important to monitor your blood sugar levels before bed and in the morning. Keeping a balanced diet, eating a small protein-rich snack before bedtime, and avoiding alcohol or excessive caffeine in the evening can help stabilize glucose levels. If sweating disrupts your sleep regularly, it's a sign you should talk to your doctor about adjusting your diabetes treatment plan. Proper management can help prevent dangerous blood sugar fluctuations and improve your overall sleep quality. Number 9. Restless leg syndrome. Do you ever feel an uncontrollable urge to move your legs at night? Or perhaps the tingling, itching, or crawling sensation that makes it nearly impossible to fall asleep? If so, you might be experiencing restless leg syndrome, RLS, a condition that is more common in people with diabetes. RLS is often linked to nerve damage, diabetic neuropathy, and poor circulation, both of which are common complications of high blood sugar. When blood vessels and nerves in the legs are affected, it can lead to irritation, discomfort, and an overwhelming urge to move. These sensations tend to worsen when you're resting, especially at night, making it difficult to relax. The constant movement to relieve discomfort can lead to fragmented sleep, increased fatigue, and daytime drowsiness. Over time, poor sleep can further impact blood sugar control, creating a vicious cycle. Another possible connection between diabetes and RLS is iron deficiency. Some studies suggest that people with diabetes, especially those with kidney complications, may have lower iron levels, which can exacerbate restless leg symptoms. To manage RLS, it's important to maintain stable blood sugar levels and improve circulation. Gentle stretching before bed, regular exercise, and avoiding caffeine or alcohol in the evening can help. Magnesium and iron-rich foods might also reduce symptoms. If RLS is disrupting your sleep frequently, it's best to consult a doctor. They may recommend medications or lifestyle changes to help ease symptoms and improve your overall sleep quality. Getting better sleep is crucial for managing diabetes and preventing further complications. Number 8. Waking up feeling extremely hungry. Do you ever wake up in the middle of the night feeling intensely hungry, especially craving sugary or carb-heavy foods? This could be a warning sign of blood sugar fluctuations and insulin resistance, both common in people with diabetes. When blood sugar levels drop too low during the night, nocturnal hypoglycemia, your body responds by releasing hormones that trigger hunger. This can make you feel like you urgently need to eat, often leading to cravings for quick sources of energy, like bread, sweets, or other carbs. On the other hand, if your blood sugar is too high before bed, your body may struggle to regulate it, leading to an energy crash while you sleep. This drop can wake you up feeling weak, shaky, and ravenous. Poorly managed insulin levels can cause this cycle to repeat night after night, worsening overall blood sugar control. Frequent nighttime hunger can also indicate insulin resistance, meaning your cells aren't absorbing glucose properly. As a result, your body still thinks you need more food, even when your blood sugar levels might already be high. To prevent this, try eating a balanced meal with protein, fiber, and healthy fats before bed. Avoid high sugar or processed foods in the evening, as they can lead to blood sugar spikes and crashes overnight. If nighttime hunger persists, talk to a doctor about adjusting your diet, medications, or insulin levels to stabilize blood sugar and improve sleep. Number 7. trouble falling or staying asleep? Do you find yourself lying awake at night, struggling to fall asleep, or waking up frequently? If so, your blood sugar levels could be to blame. Blood sugar imbalances, whether too high or too low, can disrupt your body's natural sleep cycle. High blood sugar, hyperglycemia, can cause excessive thirst, frequent urination, and restlessness, making it difficult to stay asleep. On the other hand, low blood sugar, hypoglycemia, can trigger night sweats, hunger, and sudden wake-ups as your body tries to correct the imbalance. Nerve discomfort caused by diabetic neuropathy can also make it hard to relax. Many people with diabetes experience burning, tingling, or pain in their feet and legs, which worsens at night when there are fewer distractions. This discomfort can keep you tossing and turning, further disrupting your sleep. Lack of quality sleep creates a dangerous cycle. Poor sleep increases insulin resistance, making it harder for your body to regulate blood sugar. Over time, chronic sleep deprivation raises the risk of type 2 diabetes and worsens existing symptoms. To improve sleep, try maintaining a consistent bedtime routine, avoiding high sugar or high carb meals before bed, and keeping your sleeping environment cool and dark. If insomnia persists, talk to your doctor about checking your blood sugar levels at night and adjusting your diabetes management plan to improve sleep quality. Number 6. Tingling or numbness in feet and hands. Do your feet or hands feel numb, tingly, or like they're falling asleep, especially at night? This could be an early sign of diabetic neuropathy, a type of nerve damage caused by prolonged high blood sugar levels. Diabetes can damage small nerves, especially in the extremities, leading to sensations like burning, tingling, pain, or numbness. These symptoms often worsen at night, making it difficult to sleep. Poor circulation, another common issue in diabetes, can further reduce oxygen and nutrient supply to the nerves, intensifying discomfort. Over time, nerve damage can lead to loss of sensation, increasing the risk of unnoticed injuries, infections, and even foot ulcers. If left untreated, this can result in serious complications, including amputations in severe cases. To manage diabetic neuropathy, it's crucial to control blood sugar levels, improve circulation through regular movement, and ensure proper foot care. If tingling or numbness becomes persistent, consult a doctor immediately to prevent further nerve damage and potential long-term complications. Number 5. Unexplained nighttime fatigue. Do you wake up feeling exhausted, even after a full night's sleep? If you're constantly tired at night or struggling with low energy levels, it could be linked to blood sugar imbalances caused by diabetes. When blood sugar is too high or too low during sleep, your body has to work harder to restore balance, leading to disruptions in deep sleep cycles. High blood sugar, hyperglycemia, can cause frequent urination and dehydration, leaving you feeling drained. On the other hand, low blood sugar, hypoglycemia, can trigger night sweats and sudden wake-ups, preventing you from getting restorative sleep. Another factor is poor insulin regulation, which can cause energy crashes in the middle of the night. Your body may struggle to process glucose efficiently, leaving your cells starved for fuel, even while you're sleeping. If you're experiencing unexplained nighttime fatigue, keeping track of your blood sugar levels before bed and in the morning can help identify patterns. Adjusting your diet, meal timing, and physical activity may improve sleep quality. If the fatigue persists, consult your doctor to rule out underlying diabetes-related complications. Number 4. Gasping or stopping breathing during sleep apnea. Do you or your partner notice gasping, choking, or pauses in breathing while you sleep? This could be a sign of sleep apnea, a serious sleep disorder that is more common in people with diabetes. Sleep apnea occurs when the airway becomes partially or completely blocked during sleep, causing brief interruptions in breathing. These pauses can lead to dangerous drops in oxygen levels, forcing your body to wake up repeatedly throughout the night, even if you don't remember it happening. As a result, you may experience daytime fatigue, headaches, and difficulty concentrating. There's a strong link between sleep apnea, diabetes, and obesity. When breathing is disrupted, the body releases stress hormones that increase blood sugar levels and insulin resistance, making diabetes harder to manage. Over time, untreated sleep apnea raises the risk of high blood pressure, heart disease, and stroke. If you suspect sleep apnea, talk to your doctor about a sleep study. Treatment options like CPAP therapy, weight management, and lifestyle changes can improve both sleep quality and blood sugar control, helping you feel more rested and healthier overall. Number 3. Frequent nightmares or vivid dreams. Do you often wake up shaken by intense nightmares or vivid dreams? This could be more than just an overactive imagination. It might be a sign of blood sugar fluctuations affecting your brain during sleep. When blood sugar drops too low, hypoglycemia, at night, your brain may become overstimulated, triggering intense, bizarre, or disturbing dreams. On the other hand, high blood sugar, hyperglycemia, can also affect sleep quality, leading to restless nights filled with vivid dreams. Frequent nightmares can be a warning sign of poorly managed diabetes, especially if they're accompanied by other symptoms like night sweats, sudden waking, or a racing heart. If you experience this often, consider checking your blood sugar levels before bed and making adjustments to your diet or medication under medical guidance. Improving blood sugar stability can lead to better sleep and fewer nightmares, allowing you to wake up feeling more rested and refreshed. Number 2. Increased heart rate or palpitations at night. Have you ever felt your heart racing or pounding while lying in bed? An irregular heartbeat at night can be a serious warning sign of blood sugar imbalances. When blood sugar drops too low, hypoglycemia, the body releases stress hormones like adrenaline, which can cause a rapid or irregular heartbeat, sweating, and even anxiety. On the other hand, high blood sugar, hyperglycemia, can lead to dehydration and increased heart strain, also affecting heart rhythm. For diabetics, nighttime heart palpitations can signal fluctuations in blood sugar levels that might require urgent attention. If this happens often, consider monitoring your blood sugar before bed and after waking up. Drinking water, adjusting meals, or consulting your doctor about medication timing can help prevent dangerous blood sugar swings that affect your heart. Ignoring this symptom could increase the risk of serious complications like heart disease or diabetic neuropathy, so don't overlook it. Number 1. Waking up feeling dizzy or lightheaded. Do you ever wake up feeling dizzy, unsteady, or lightheaded? This could be a serious warning sign that your blood sugar levels are too low overnight. Low blood sugar, hypoglycemia, can occur if you go too long without eating, take too much diabetes medication, or have an imbalance between insulin and glucose. When blood sugar drops too low, the brain doesn't get enough fuel, leading to dizziness, weakness, confusion, or even fainting. Another possible cause is dehydration or poor circulation, both common in people with diabetes. High blood sugar can make the body lose fluids faster, leading to low blood pressure and dizziness in the morning. If this happens frequently, check your blood sugar levels before bed and in the morning. Drinking water, having a balanced bedtime snack, or adjusting medications with your doctor can help prevent these episodes. Don't ignore dizziness. If left unchecked, it could lead to serious complications like fainting, falls, or even diabetic coma. Diabetes symptoms don't just happen during the day. Your body gives you warning signs at night too. Ignoring these symptoms can lead to serious complications, including nerve damage, heart issues, and poor blood sugar control. If you experience any of these nighttime signs regularly, it's important to check your blood sugar levels and consult a doctor as soon as possible. Early intervention can prevent long-term health risks and improve your quality of life. Which of these signs have you noticed before? Let us know in the comments. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more life-changing health tips every week.